So let's dig into some of these questions here. And so, Kendra, I'm going to start with you. Can you lay the groundwork for us? What are some of the unique challenges that small rural healthcare delivery organizations are facing when it comes to cybersecurity?
To me, when you're looking at rural and small entities, I'm thinking rural hospitals, especially ones that are critical access hospitals, they usually have 25 beds or less. Also, independent physician practices, nursing homes, mobile clinics, behavioral health centers, and those that deal with substance abuse. And then there's also another kind of healthcare workforce that's in a lot of these communities that they aren't typically part of the traditional healthcare delivery system. And those are ones that deal with a lot of social determinants of health and navigating patients, and they also use technologies to connect them to physician practices and health systems and things. So that's also a group that we recognize being in that space of rural and small entities. And then when it comes to what are those unique challenges that they face with cybersecurity that increases risk, there's really three to me that kind of come to mind. The first is, of course, the limited resources. So they have limited financial and human resources. And when they're working on cybersecurity programs or trying to get technologies or just make a step where they're improving their cybersecurity posture, it's not something that's routine for them to do. So think about at your workplace, if there's a new project that you're working on, it requires a lot of different roles and leaders to weigh in and have responsibilities, and you don't have a roadmap yet. That's what they're dealing with when they're working with cybersecurity. So that does make that difficult. Another piece is that they have limited kind of the wraparound systems for that, like legal counsel, like they don't have the specialized legal counsel for technology, and they don't have the money really to put into that for contracts. It's hard for them to hold their IT subcontractors accountable for things. Sometimes their policies are there for compliance reasons, so what their actions are in terms of cybersecurity and what they have in their policies are two different things. And then, of course, there's factors that exacerbate this lack of cybersecurity effort. That's very little time to do cybersecurity work. They don't have trained manpower. They don't have the manpower necessarily. So that causes them to rely heavily on vendor information, on word of mouth, on their IT subcontractors. And that's not the best thing to do when you're trying to protect cybersecurity at your facility. Also, you'll hear a lot of rural staff say, we wear a lot of hats. It means that they have to play a lot of different roles day to day. And typically, the hat is not a cyber hat. So, they're multitasking, they're in an environment where they're switching back and forth with things that they're doing. And the environment tends to be more reactive than it is proactive. So they're always catching up. So doing cyber is just yet another thing to do that's not going to bring them funds at the end of the day for their business. Also, the thought of a insider threat, it's underestimated in these places. They come from tight-knit communities. They feel like they're in the trenches, working for their rural health delivery organization. So they have a bonding that occurs there. So implicitly, there's this sense of trust with other workers. So you will run into, sharing of passwords and doing other things that are probably not the best for access control because they trust each other there. A lot of rural hospitals that I've spoken with, they say, oh, we don't have an issue with insider threat. And maybe somebody's not doing something malicious, but certainly mistakes happen. Most of the time, cybersecurity incidents are caused by human error. So that's just something else that they need to look at. The final thing is social engineering. I know we talked on day one a lot of it about AI use with social engineering. So even though they've been getting phishing campaigns and training and they know to look for misspellings and this and that, this is a whole new ballgame with more sophisticated social engineering attacks, and it's very hard for them to know what not to click on. So I think that's probably a good start.
Yeah.
Thanks.